So the transcutaneous monitor gives us a little bit more information than simply our pulse oximeter, as we've talked about with the oxygenation non-invasive monitoring and the ventilation non-invasive monitoring. Do we have other technologies that can help us monitor our patient's ventilation status non-invasively?
Yeah, so the one that's been around for a while and we use it all the time is end-tidal CO2 monitoring. And so this comes in a couple different formats. It comes in where we get a graphical display of a capnograph, or sometimes we just get a numeric display, or both, oftentimes both. And what end-tidal does is it reflects carbon dioxide that's exhaled from the alveoli versus the transcutaneous or something being on the skin. This is actually measuring the breath that's coming out. So things that affect end-tidal CO2 would be ventilation, physiologic dead space, patient metabolism, perfusion, and things like that, or lung perfusion. And then, really, end-tidal is becoming increasingly more and more popular. It's been around for a while, but I think that people are investigating how we're going to use it even more. So we've been using it on mechanical ventilation for a long time, Shauna, but we're also using it quite a bit in things like procedural sedation and on transport. And on transport, it can help us make sure that the tube hasn't come dislodged and so forth. And in the non-invasive application, it could simply be to make sure that the patient who needed some light sedation is literally still breathing.